Welcome to section 19.6 of Metabolism. In this video, we'll focus on memorizing the details of Hurler syndrome and Hunter syndrome. Let's get started. This scene will take place in Alaska as part of the infamous Iditarod trail sled dog race. The person here is taking a break from the race and is hurling javelins at the trees. Hurling sounds like Hurler syndrome, so this will be our symbol for Hurler syndrome. Notice that this athlete is wearing sunglasses to protect his eyes from the bright reflection of the snow. If you look closely, you can see that the blue clouds are reflecting off of the glasses. The glasses represent the cornea, and the cloud reflection represents corneal clouding. For step 1, you should know that one of the clinical features of Hurler syndrome is corneal clouding. So sunglasses with blue reflection for corneal clouding. In order to make javelin hurling an effective use of time, it would probably be a good idea to have some sort of target in order to assess accuracy, right? So in this story, our athlete character has placed a gargoyle target on the trees for this purpose. The gargoyle here should help you remember that one of the clinical features of Hurler syndrome is gargoylism. Gargoylism refers to the dysmorphic facial features seen in Hurler syndrome, including an upturned nose and thickened gums. So gargoyle for gargoylism. Okay, let's zoom up on the gargoyle so you can see some of the details better. Notice that the gargoyle is pinned up against the tree at the hips with a little red pin. Hip pin sounds kind of like heparin sulfate, so this represents heparin sulfate, which is one of the accumulated substrates in Hurler syndrome. This is also accumulated in Hunter syndrome, which we'll talk about in a second. So hip pin for heparin sulfate. Notice that the spelling of heparin is different from heparin. Heparin with an IN is an anticoagulant. Heparin with an AN is the accumulated substrate in Hurler syndrome. Okay, while we're zoomed up on this gargoyle, let's discuss another point. Notice that one of the javelins is in the gargoyle's neck area. Obviously, the athlete needs a lot more practice because he totally missed the target. This javelin is here to help you remember that one of the clinical features of Hurler syndrome is airway obstruction. So javelin in the neck for airway obstruction. Okay, now let's zoom out and continue with our story. If you've ever been at a target range or out to shoot for fun, you may have used cans for target practice. So in this story, we've added some used dirty cans that this athlete may use once his gargoyle target is obliterated. The dirty cans on the ground are here to help you remember that another accumulated substrate in Hurler syndrome is dermatan sulfate. Dirty cans sounds kind of like dermatan, so dirty cans for dermatan sulfate accumulation. Like I mentioned at the beginning of the video, this scene takes place in Alaska as part of the Iditarod trail sled dog race. So we thought it would be appropriate to include a sled with dogs in the background. The Iditarod race with a sled back here is to help you remember that in Hurler syndrome, the deficient enzyme is alpha-L-iduronidase. Iditarod sounds like iduronidase, so this sled should help you remember the deficient enzyme. Notice that the sled is in the background and at a lower level from where the athlete is. This is to help you remember that alpha-L-iduronidase is the deficient enzyme. So Iditarod race with the sled down low for low levels of alpha-L-iduronidase. Okay, now let's turn our attention to this javelin stuck in the trunk of this small tree back here. This guy must be a terrible aim. Not only did he hit the gargoyle in the throat, but he also managed to hit this small tree that's at least 10 feet away from his target. Maybe he'll consider hiring a coach to help him out. Anyways, this javelin stuck on the small tree is here to help you remember that one of the clinical features of Hurler syndrome is developmental delay. Notice that as you move back from the gargoyle to this small tree, the trees get progressively smaller. The tree that has been struck is the smallest tree and is obviously experiencing some sort of developmental delay compared to the trees around it. Also, the damage inflicted from the javelin will most likely delay its development even more. So, javelin in the small tree for developmental delay. Because this is a sled dog race, it would be fitting to include some dogs in the image, right? So we've included this eager-looking Dalmatian dog as part of the story to help you remember that one of the clinical features of Hurler syndrome is hepatosplenomegaly. If you look closely at the dog, you'll notice this spot that is shaped like a liver. So liver spot for hepatosplenomegaly. Now we've added this old retired hunter guy sitting on the log, giving the athlete some pointers. Looks like he got a coach after all. Hopefully his aim will improve soon. From the image, you can tell that this hunter is retired because he looks old and he also has a gun bag sitting next to him. He isn't actually using his gun. He just brings it along in the gun case to teach others about hunting. So, old hunter with gun case for Hunter syndrome. If you look closely at the gun case, you can see that there are multiple lizard designs inscribed in the case. The lizard is here to help you remember that both Hunter and Hurler syndromes are lysosomal storage diseases. So lizard for lysosomal storage disease. Hunter syndrome has been included in this image because it's very similar to Hurler syndrome. In fact, the accumulated substrate, deficient enzyme, and clinical features are all similar, so we don't need to discuss those ideas again. However, Hunter syndrome is considered a mild form of Hurler syndrome, with a few differences which we'll discuss now. Notice that unlike the athlete who is wearing sunglasses, the retired hunter has glasses on top of his head. Also notice that they're not blue, they look completely clear. This alludes to the idea that there is no corneal clouding in Hunter syndrome. So clear glasses on top of head for no corneal clouding. The athlete character has a Dalmatian, but this retired hunter guy has a very aggressive looking German Shepherd. The aggressive dog is here to help you remember that one of the clinical features of Hunter syndrome is aggressive behavior. So aggressive dog for aggressive behavior. Okay, one last point. We have a separate video to help you memorize all of the X-linked recessive disorders, but you should know that Hunter syndrome and Fabry disease are X-linked recessive lysosomal storage diseases, while all of the other lysosomal storage diseases are autosomal recessive. Because we haven't included anything for Hurler syndrome, you can assume that it must be autosomal recessive. We also didn't want to include an X on this image to confuse the inheritance of Hurler and Hunter syndrome. However, recall from this image, which is to help you memorize all of the X-linked recessive disorders, that the old retired hunter guy right here represents Hunter syndrome. Hopefully by remembering this image, you can recall that Hunter syndrome is an X-linked recessive disease. And with that, you should have everything you need to memorize about Hurler and Hunter syndromes.